I got pretty good. And then around age 13, 14, around the time I started hitting puberty, I started noticing certain things were off. So I was a really fast runner when I was younger. And then I started getting slower and slower, and started tripping a lot more. I had a lot of balance issues, and I didn't really know why at the time. Then I also started noticing that when it got cold outside, it was very, very hard to start gripping the ball. And as a pitcher, that's a really bad sign. So I started if I was throwing it to first base or like wherever, I started actually like overthrowing the ball because I was gripping the ball so hard. So it was physically like my hands were physically numbing, and I wasn't able to feel what was grabbing the ball, right? There was also scenarios where in gym class, when you would change from your PE clothes into your regular clothes again, I could not button my jeans back up if it was in the morning. So I remember very embarrassingly asking a few of my girlfriends if they could help me like button my pants, because for some reason my thumb would lock up in the cold. And again, having no idea why, it was just kind of quote normal for me, and that was just kind of what was going on. In my head, I didn't know what was going on, but it really wasn't anything that I couldn't handle. I just felt that I had to work 10 times harder than anybody else, and that was fine with me. I was just like, you know what, I'm dedicated, I'm hardworking, let's get this figured out. So fast forward to ninth grade high school softball tryouts. One of my biggest goals in life at the time when I was a teenager was making the high school softball team. It meant a lot to me that I had put all of this hard work my whole entire life towards softball, and all of my cousins and family members were very big sports people. And so eventually my goal was to be in a high school team. So first year I tried out in ninth grade, didn't make the first cut. I was devastated. I was shocked. I was confused, right? And so my dad and I reevaluated, and we said, all right, we're gonna do running training in the morning, and you are gonna do pitching training. We're gonna do all this training for a year so you can go ahead and do softball tryouts. I also just realized I wanted to record this, and I am not recording it. So once, thank you. You are the best.
Thanks, Sarah, because she reminded me.
Thank you. Oh my gosh. Okay. ADD here. So you guys can still see my screen. Yes. Sharing screen.
No, I see you.
Oh, okay.
Not the presentation.
Oh my gosh, you guys, I'm so sorry. Let me do this one more time. Share screen. Here we go. Thank you. Cool. So back to it. Worked really, really hard for about a year, and tried out again, 10th grade. I remember also when we were doing running training that my dad would tell me to run on my toes and drop my butt, and there was this whole form to running, and I remember listening to him and doing the best that I absolutely could to do what he was asking, and my body physically could not do it. And I, again, didn't understand why. There was conversations with me and my dad of like, oh, are you listening to me? Do you understand? I'm like, yeah, I get it. I'm trying, and I couldn't. And so, so 10th grade tryouts, there's about 3 different cuts, and I made all of them except the last one. Very last one got cut. And again, devastated, furious, all of these emotions going through me. So what ended up happening is, this is still one of my dreams and one of my goals. I actually asked my parents if I could switch high schools to try out for a different high school team, because I just wanted to play softball so bad on a high school team, and they allowed me to do that. To put a long story short, the first day of tryouts, I rolled my ankle, and that was I started crying. That was probably the worst experience of my life, besides already getting cut twice. And I was like, great, I'm falling, I can't run, I'm trying to be athletic, I don't know what to do, what's going on. And I was in shock again. But guess what? I actually made the team. I guess it worked out in my favor switching that school. I made varsity and got to play as a pitcher, got to run, got to hit, got to make a lot of friends. And I played, and it was awesome. So don't give up. Don't give up is what I'm saying. So now we're going to go into a little bit of the therapy identity aspect of it, right? So pre-diagnosis of CMT, I thought I was normal, and I really put normal in quotation marks because I think if you think somebody's normal, you just don't know them well enough yet. You know what I'm saying? So eventually, over time, you'll get to know they're normal, right? And the whole normacy was I was able-bodied and I was fine. There was all of these things that I couldn't do, but I didn't know why, and I couldn't do these simple tasks. I remember I always had to ask somebody to open a water bottle for me, and I associated that with being a girl. Oh, I'm just too weak to open my water bottles. I can't do this because I'm a girl, or whatever I had in my head, right? Another part of this pre-diagnosis was when I started driving. My mom noticed how skinny my hands were when I had them on the steering wheel, and they had looked like that my entire life. So I thought nothing of it. I thought it was normal. Eventually, I learned that, yeah, my hands are pretty skinny. My hands don't really have muscle in them. I don't know what causes that, and maybe I should talk to others about it. I'd like to share a little bit about my diagnosis story and what was going on during that period of my life. So I got diagnosed in 2013. That's the year that I turned 18, graduated high school. I had my first death in the family. My uncle passed away from cancer. I have his beautiful picture with my other cousin Amanda on the right there. And that was a really traumatic experience in itself, since he was like a father figure to me. Again, I moved out of my parents' house and into an apartment. I was trying to live like this, what normal adult 18-year-olds are supposed to do. You move out, you get a job, you go to college, you do all the normal stuff. I was still experiencing anxiety and depression, and I associated that honestly with my uncle and just all these transitional adjustment disorder, whatever you want to call it, everything that was going on in my life. Then I get diagnosed with a physical disability. And in my head, you thought 2020 was bad. I kind of think that was a little bit worse at the time for myself. So how did I get diagnosed? How does one get diagnosed with something? So this CMT is a hereditary neuropathy, which I'll explain a little bit more in the biological aspect in a minute. But my grandmother has multiple sclerosis. She has MS. So I put a few pictures of us together, and I was talking to some relatives of mine about how skinny my hands were, and thought that was strange, but didn't really know why. One of my other uncles had talked to me that Nanny had MS, and she's the only other person who has hands like mine. So I had to go to the doctor. I had to know what was going on. There's a few ways to get tested and diagnosed with CMT. You can get genetic testing done, but I didn't even know what I was dealing with at first, right? So my uncle recommended I go to the doctor. I went to my primary care physician, and he said that I might have this thing called CMT. And like everybody else, you're probably thinking, what is CMT? What is this? And so I went to a neurologist because I had to go to a specialist. You get a clinical evaluation. There's a few different testings that you do. I also got an MRI besides getting the nerve conduction test and the EMG. So what they're specifically testing is how fast your nerve cells are talking and communicating with one another. That's basically it. So, answering your question, what is CMT? CMT, again, is an inherited neurological disorder. It affects 1 in 2,500 individuals, which is absolutely outstanding because so many people don't know what it is or have never even heard of it before or associate it with country music television. It is a physical disability. It is slowly progressive, and I put slowly in quotation marks because I think it varies from person to person, depending on what type of CMT that they have. And if they're stressed, I think stress is a huge factor of whether it starts getting worse or not, which I'll go into. Currently, there is no cure for CMT, and usually it's not fatal. However, there are certain forms of CMT which are very severe, very significant, very impactful to a person's life, and can kill them. Real quick, I'd like to talk about the biological aspect of it, what's actually happening within our nerve cell. So the importance of your peripheral nervous system is that communication, electrical signals. It is how your body functions, right? There are two different aspects that I'd like to talk about. There's the axon and there's the myelin. So the axon is the part of the nerve that is the actual like body part. So if it were a wire, it's the inside of the wire. And the myelin is a fatty lipid bilayer that surrounds it, that insulates it to make it go even faster. So again, if it's a wire, there's the body, which is the axon, and then there's the wire, that's the thing that covers it. What happens with people who have CMT is either their axon is not functioning properly or their myelin is degenerating. And over time, what this does is it makes the connections so much slower. It slows down that signal, and it has the, oh my gosh, has the ability to lose or.
I thought she was on the video.
I am on a video.
You
You can go. Sorry, everyone. This is what I'm being distracted with during my very serious presentation.
I have it of the nose.
He does have it of the nose. It's also being Italian. But anyways,
Air is free.
air is free. Anyways, so what happens is the when the nerves are not communicating fast enough, it causes the ability to communicate, which eventually kills the cell. Like it dies. It literally dies, which results in muscle weakness and the atrophy that happens within our extremities. It happens within our arms, our legs, our hands, and our feet. So over time, that muscle goes away because of the communication, the lack of communication. There again, I've been talking about the different types of CMT. There's CMT 1, 2 that are affecting the different parts. You can also look on the CMTA's website for more information, or just simply Google types of CMT for more information about specific types and how it affects the cell. So again, with my symptoms, and most common symptoms are muscle wasting, muscle atrophy in hands, lack of fine motor skills. But clearly I can still hold a drink in my hand, so that's all I care about. So happy about that. I have very poor tolerance for cold temperatures. Again, like I was talking about having a difficulty buttoning my jeans. That happens. Symptoms within my feet and my legs. A lot of people have ankle sprains, I rolled my ankles a lot. I probably rolled my right ankle anywhere between 15 to 25 times, and my left ankle probably, I think, like 11 times. So we have balance and stability issues. We get a lot of muscle cramps, so we get Charlie horses kind of randomly within our legs. There's like a pins and needles and numbness sensation that can happen. There are structural foot deformities. So with me, I have like pretty high arches within my feet, which is what the arrow is pointing at. And then some people have hammer toes. So an example that I really like giving is putting a pair of socks on your hands. Now, I've watched a bunch of CMT videos from Bethany and Gina and other people in the CMTA community that have given this example. So shout out to them. They're amazing, doing great work. You put a pair of socks on your hands and you do fine motor skill tasks. So you can do anything from tying your shoelaces, putting on earrings, putting your hair up, opening a water bottle, opening up a Tylenol. You start to think about all of these activities that you once could do so easily, buttoning up a shirt, buttoning up your jeans, and now trying to do it with a pair of socks in your hands. Difficult, right? Not impossible, but difficult. And you have to live like that every single day. So just a few questions for you to kind of think about, what would that be like for you? What would that be like to experience that with a client if a client had that? Has your perception of CMT changed now that you've experienced it yourself? if you decide to do the CMT sock challenge, I highly recommend recording it. You can send it to me or put it up on YouTube, share it with your friends, spread some awareness in there. That would be great. So kind of think about what that would be like for a client for you, or even for you to experience on a daily basis of having a pair of socks in your hands and trying to do things. There's a lot of variability that happens when you're getting diagnosed. I got diagnosed when I was 18. That's a very transitional period of your life, and that impacted me a lot in many ways. Some people get diagnosed with CMT when they are 2 years old. They can be as young as 2. They can be diagnosed when they're 10, 12, 40, 50. It can be any age, variation of any age that they get diagnosed. And there are different, there's different gender differences, right? So earlier I was talking about how I had this girl stereotype of I couldn't open a water bottle. And what would it be like for a guy experiencing that? That must be really hard, like especially hard for them to have to experience that. What type of CMT do they have? What is the severity? Are they using a wheelchair? Do they have braces? CMT is genetic, but also it can be a genetic mutation. So in my family, my grandmother, my dad, and I have it, but in other families, one of my friends, Peyton, she is a genetic random mutation. So no one in her family has it, and she didn't have anyone growing up to experience it with, to understand, to talk to. So we have to understand all of the dynamics there. Getting diagnosed is kind of like a process in itself of the stages of grief is how I would explain it. So if you don't know what the stages of grief are, it's shock, denial, anger, bargaining, depression, or if you look at the picture, it is a series of one thing after the other. It's not like stage 1, stage 2, stage 3, blah, blah, blah. It can go in and out of denial, and then you're okay, and then you're not, and then you're angry, and then you're depressed, and blah, blah, blah. It can go in all different directions. Personally, for me, I actually repressed my CMT diagnosis. I was in complete denial. I said, I've been athletic my whole entire life and I'm fine. I don't have anything. You don't control me. And I have nothing wrong with me, is what the bottom line was. Then I got really angry at my diagnosis. Why me? Why do I have to deal with this? Why am I experiencing this? It's not fair, right? Then it turned somewhat into sadness. It was this forcing to accept a new identity, and an identity I didn't even ask for. So that all of that has different processes within itself that we all have to experience and go through. I think even at a young age, at like getting diagnosed at 2 years old, you still have these questions in your mind. Even if you're diagnosed at a young age, why me? I don't have anything wrong with me, things like that. If any of you have seen the robot chicken giraffe get stuck in a tar video, that's the YouTube clip that I wanted to share. You can also just look it up real quick. It's about the stages of grief, and it's very funny. So I highly recommend anyone looking at that. So going back into the seriousness a little bit, there were many questions that like popped into my head after getting diagnosed, that I have talked to many people with CMT that also experience these questions. So I wanted to go through them and have them in your mind. Will I have to use a wheelchair? Am I going to be treated differently? What is it going to be like telling a boyfriend or a girlfriend about this? Are they going to accept me? Do I accept me? What is it like for the family? Would our relationship change? Would I change? What is it like having a new identity? I think these are all serious and valid questions that anyone with a diagnosis goes through. Process these with your client. Really make sure that they have some sort of answer to these questions, and process it with them. There is also the label aspect of getting diagnosed with a mental illness or a disability. Getting diagnosed with something, this is now part of your label. You are no longer just the athletic Cheyenne. You are no longer just, whatever your identity was, right? You are now, the girl with this disability, right? That's That's one way of looking at it. But there are many ways people can look at it. Some can choose the victim card. Oh, I have this thing, take care of me, woe is me, blah, blah, blah. Okay, that is one, and that is valid. It is a very serious condition. It is very difficult to deal with, right? There's also something that I had to learn and had to realize is that for me, it was more of an answer to my questions. I had been struggling for a very long time of wondering what this disease was or wondering why I was rolling my ankles and tripping all of the time. I was wondering why I couldn't button up my pants. I've now had an answer to my question. So it wasn't necessarily a label, it was an answer. And then my path went to, I wonder if other people have this. What are their experiences like? Am I alone in this? You know, I thought of all of these different questions around that label. And eventually it turned into CMT technically had always been a part of my identity. I was born with it. I just didn't have the word. I didn't have the expression, oh, I need you to help me button up my jeans because I have CMT. You know, I didn't have that once before. Now I do. Shifting perspectives, it really for me was it's no longer you are not good enough. It is just simply I have a disability, but that doesn't have to define me, right? I have CMT, but it does not have me. Another thing is to learn about their disability and the options that they face. So we have different disability aids that happen. I got AFOs about a year ago, and I really have loved them ever since. Some people have a different experience. They have like plastic ones that are very uncomfortable. Mine are made out of carbon fiber. They're also making new technology every 10 years or so.
Explain what AFOs are.
AFOs. Oh, okay. Thank you. So AFOs are like these really intense braces that I have shown right here in this picture of me. They basically help out with my balance and stability. And I also have these like intense orthotics that are in my shoes. So they're kind of like if you go to Walmart and go to Dr. Scholl's and put those things in your shoe to make it more comfortable, that's what I have in my shoes, but it's like the professional type. So I wear those pretty much every day. I also wear them outside of my jeans and all of my clothes because I would like to spread awareness about CMT. If people ask questions, oh, what are those? I also like showing off that I want to be the next Iron Man. So I like to wear braces outside to be just like Iron Man. Some people are not comfortable with that. Maybe they're not there yet, and that's totally fine. They can wear them under their jeans and have this like normal perspective, right? I also have some sleeping braces that flatten out my feet because I have, again, really high arches. And so this flattens out my foot and it has it stretches out my foot so it doesn't hurt as bad in like the next morning, or like if I wake up and I'm having really bad foot pain, I can use those. Some people have really bad CMT and they have to get reconstructive foot surgery, or again, it's a slowly progressive disease. So maybe they don't have to have surgery right now, but eventually it gets so bad that they are in so much pain, they can no longer walk, that they need to get surgery. I would also say that people can get wheelchairs, and I know a lot of people who use wheelchairs, and it gives them such independence, right? They don't have to ask anybody else for help. Sometimes they might need help, but usually it just gives them this sense of independence and a new life and a new experience. So it's not always bad. And personally, I have used some CBD creams and oils that have helped out, like using lotions if I'm in a lot of pain. And right now I am on an SNRI, not an SSRI, but an SNRI medication that helps out with anxiety, depression, and chronic pain. If you choose this route, I would definitely talk to a psychiatrist and get the best pill that works for you. CMT is definitely a part of the invisible disability spectrum. I'd just like to give a few examples first of an invisible disability. So people who are deaf, people who have diabetes, people who have any kind of chronic pain or mental illness, an invisible disability is something that's not apparent. It's these people have an issue for the rest of their life. They have pain the rest of their life and need accommodations. But you, a normal able-bodied person, may not be able to tell because you can't see a wheelchair, you can't see the AFO, you can't see the pain that they are enduring. Doesn't mean that they don't have something wrong with them. A lot of people with CMT experience having a microaggression. An example of a microaggression is you are too healthy looking to be disabled. I think I get this pretty often. Again, I am about 5'4", athletic body type, 25, young looking person, and I have a handicap placard and I use it pretty much all the time wherever I go. If I do not have my braces on, people will look at me and judge me and be like, what is wrong with you? You look totally fine. And that's part of having an invisible disability is accepting that other people don't understand what you're going through. But I would still utilize everything that you possibly can to help better yourself and better your life and better your body. I decide to use my handicap placard because it's going to help benefit me. I don't care about the other person. It's about me, my happiness, my health. The other part I would like to discuss is the aspect of ableism. And we need more advocacy for the disability community, even the invisible disability community, so we can educate able-bodied individuals to put us together to make sure that we get all of our needs met. So my example is always in gyms. I would say there's a lot of ableism that happens within gyms. And we need to basically connect those together to make sure that people in wheelchairs or that they have disabilities, they're getting all of their needs met within a gym. Anxiety and depression is very common in people who have CMT. Some of the considerations that you might not recognize is anxiety while picking up change. So again, with the sock example, if you put a pair of socks on your hands and start doing things, if you try to collect change, that's going to be very anxiety ridden. Let's say you're at a grocery store and you are exchanging change with the cashier, and the cashier now has to give you back the change and you have a pair of socks in your hands. That's going to be very anxiety ridden. Then guess what? Change falls on the floor. How are you going to pick it up with socks in your hands? So a lot of these things we are taking for granted when we need to be in the perspective of our clients of what anxiety are they experiencing every single day. The other thing I would like to note is walking and consistently having to think about it. So before I got a pair of AFOs, I used to literally look down at every single step that I had to take. And over time, I didn't even realize that I was thinking about every step so I wouldn't fall, or I was preparing to fall all the time, constantly. That's constantly in your head. The minute I got AFOs was the first time I had ever walked without having to think about it. And I didn't even realize that was something till that experience happened, right? So normal able-bodied people don't even think about walking. People with CMT constantly think about how they are walking, where they are walking, and everything that's on the ground or in front of them. I discussed the men and women stereotypes. I feel bad for the men that have CMT. I think it's a little bit harder on them to an extent because of the stereotypes of, being a strong man and a provider and all of these aspects that can be really challenging for a guy with CMT. They might not be able to do sports if they want to do sports, and that's really hard on them. A big part of it is feeling not good enough for doing basic tasks. So doing the simplest things. Wow, I can't even open a water bottle myself. Wow, I can't even floss. Wow, it's such simple tasks that seem so easy. And for us, it's like the biggest and most difficult things that we can experience. Another part of it is chronic pain. Experiencing pain on a daily basis is really hard to deal with. So with having depression, I would say that a lot of people with CMT experience having depression, that they feel alone. And the fact that they feel like nobody understands them. They have this disability, they have a diagnosis, and nobody else around them can really relate. If they just get diagnosed at a young age, they're the only ones in their school that have it, right? Or I was the only one in my college classes who had it, or they feel like nobody understands them. So I would say a big part of healing is the importance of having a strong support system. I love my support system. My support system is here with me today, and I am so thankful for all of you in the CMT community who have changed my life. Thank you for Camp Footprint. I'm going to go into a little bit about support system and how important it is to have. So there are different types of like Facebook groups, social media platforms that you can go to get more information about CMT, or to meet somebody with CMT, or to talk to somebody who has CMT. There's like parent groups, there's a gaming group for like kids with CMT, just to be able to connect and not feel so alone in this crazy world that we're going through. There are Instagram pages where there's like how to work out with CMT, or mental health, how to cope with CMT if you have anxiety and depression. The CMT Youth Council. This is Youth Empowering Youth. I think I have some of my youth people here who I would love for them to speak about what they are, what projects that they are doing currently. So we'll go into that a little bit later. There's various teen outings that we go to. I know the first time I met one of the first people I ever met was Johan, Johan and Jonah, we all met in the LA conference, went to a teen outing. So we went bowling. And at first I was like, Jonah, you're crazy. Why are you having all these people with CMT who like can't use their hands and can't walk right? We're like funny, why are we bowling? And it was probably one of the most like eye-opening experiences to have all of these kids with CMT, just like you, just like me, doing this activity together and just bonding over it, right? And experiencing it together. So we want more teen outings. There are various walks for CMT all around the nation. And this is to raise funding, to raise awareness about CMT. There's a raffle, there's lunch, there's a whole walk that you get to talk to other family members and get to talk to friends and get to hang out with your CMT community and really bond with one another. The last part is having Camp Footprint, having more things like Camp Footprint. Camp Footprint is my favorite holiday of the entire like holiday season, whatever, better than Christmas, hands down. It is a camp for kids with CMT ages 10 to 18. We have anyone who's over 18 would be volunteering as counselors. And it is just a wonderful week of teaching these kids that they are normal, and we are the tribe of the funky feet. We are a family. It's really cool to just be at a table with other people who are exactly like you, and they truly understand what you're going through. So I remember my first time just having difficulty opening up a water bottle and not feeling that anxiety for the first time in my life, because everybody else at that table knew exactly what I was going through. And it was a really wonderful experience to share that, to have that support system, to have that empathy. So we need definitely more funding for Camp Footprint and the CMTA and the CMT community. So what's next? What's the whole point? I would really just like to be able to provide good therapy for these individuals and their family members who have CMT. I want you as therapists to be able to understand to the best of your ability and to help go through the diagnosis process, to go through the CMT process with them so they're not alone. I want you to help them go through the challenges of having a disability, what that's like, having an invisible disability, to go through that decision factors of surgery or not, or using a wheelchair, or whatever that the client has to experience. I want you to challenge their negative thoughts. I want you to be able to tell parents how important it is for their kids to go to Camp Footprint, how impactful that support system is, how important the bond is between one another. I encourage this positivity. I encourage the strength-based programs that we use, but I also encourage to be in that moment with them, to process it with them, to be present with them as much as you can. I want them to not feel alone and where they have to explain themselves. This is super important to me. And I just want to say I would really want a world without CMT. And I thank you all very much for being here for this presentation. Do you guys have any questions? Thank you.
Very good.
Okay, I have a question for you.
Yes.
So was it after you were diagnosed with CMT that you decided you wanted to go into therapy and go to grad school for psychology, or was it before you were diagnosed with CMT?
That's a wonderful question. It was actually after, because when I first went to therapy, I was also 18. I originally went because I was depressed and anxious about like my uncle passing away and trying to process through that transitional phase. And then I got diagnosed with CMT after all that. So I was already going to therapy, and I was like, well, now I have this thing and I got to talk to you about that. And it just kind of turned into that. It's funny, I actually didn't even want to go into therapy at first because I was like, I don't want to listen to people's problems all day. Like, that sounds boring. And then I just started getting a passion for it when I started just wanting to help people in the way my therapist helped me, like process the anxiety and depression, process the CMT. And I was like, you know what, I really want to go into therapy because I want to help others the way my therapist helped me.
I totally agree with you. Love
Yeah,
it.
I know you want to go into therapy too.
Yes.
So I'm so, and you're on the youth council.
Yes,
I
I
want
am.
to hear about the youth council. If anyone else has any questions, like please write in the chat or like write your name and I'll call on you or just talk. And yeah.
Yeah, so I can talk a little bit about the youth council and what we've been up to.
Yeah.
So the youth council has a bunch of different committees. There are 11 youth, all under the age of 21. And we have the social media committee, which works on spreading awareness through social media and trying to gain followers and teach people about what CMT is. We have the fundraising committee, and they put together fundraiser kits and talk about how important it is to be involved in fundraising with CMT. We have the Book of Dreams, which I'm a part of. We have a really exciting project coming out in less than a month. I'm so excited about it. Everyone's been working so hard, and this is going to be a book written completely by only CMT youth about their experiences with CMT. And there's just a lot of amazing stuff happening with the CMT youth. I joined about a year ago. I had a really hard time with my CMT. I was born with CMT, and when I wasn't walking when I was 2, my parents knew something was wrong. It took 2 years to get a diagnosis. So I was diagnosed when I was 4. And so I kind of grew up with it. I was kind of always used to it. And then when I was 17, I was diagnosed with type 1 diabetic. So kind of having that double diagnosis.
Whammy.
Really
Yeah.
hard. And definitely CMT and type 1 diabetes like kind of don't mix very well. And I kind of went through a point where I was going to college, I was moving away from home, and all my friends were dating and I wasn't. And you know, that's another big thing in therapy that I know. I've been to therapy. I always had a hard time connecting with my therapist because I'm like, it's hard watching my friends be in new relationships and exciting, and like I was really the only one who wants it. And I just think that for me, I was so angry about my CMT, especially my freshman year of college. I didn't want to talk about it.
Yeah.
And my CMT is obvious. It's very it's not really easy for me to hide at all. And I finally got to the point where I was like, why am I so angry? Like, there's no point. And like you talked about the different stages of denial and grief. And I knew I wanted to be a part of the youth council, but I knew I needed to be ready to be a part of the youth council. And what like the joy that being on the council had brought me. Like, yes, it's a lot of hard work, but it's so, so important. And we have a lot of exciting things coming out. So I'm so excited for all of that to come out.
Thank you so much for giving your
course,
perspective. And like, I want to talk to you more about everything. I'm very
Yes,
excited.
definitely.
Thank you. Nikki, did you have a question? I know you were.
Oh, well, I mean, maybe I'll reserve it for later. It's not a question. It's more of a of a discussion point, but I can wait until after or
Whenever. No, this is open Q&A. Like if you want to talk, you want to hang out, like whoever.
I mean, I'm just so grateful that you've invited me to this, because I will preface, I'm really passionate about this. I minored in disability studies in undergrad, so it's just like
Awesome.
so refreshing to hear about this again. And I wish Pepperdine would dedicate like a full term. And I swear, like, we should petition you to do the class. So
That'd be awesome.
I mean, I just wanted to say I'm grateful for the opportunity to tune into your lived-in experiences and the meaning making that you've had throughout your life. And what I think is really profound is when you mentioned labels. And when we think about how the world is constructed around these very limited, standardized norms about identity as being a static thing and unable to move throughout time, it's just what's evident is the things that you've experienced in life is what you've been up against. And set in a backdrop of able-bodied people, of what we might take for granted. And I can understand that's exactly where the anxiety, depression come in, and anger, as Julia mentioned, sometimes it's necessary as a catalyst to move forward. And given that we're so constituted in our language, which I personally think is quite cynical, I think it's essential for therapists to acknowledge that.
Yeah.
Because the labels that we're often forced into do not fit or capture our lived-in experiences, which is what you've given us the gift of today. And so I was most moved by what you said. It doesn't define you because it's empowering. It's a form of resistance. It's like what Judith Butler raises, points for thought around body politics, if you're familiar with her, and how bodies are at the core of political order as markers of status and power. And I think your prowess in externalizing the label of CMT while still honoring your experience is insightful. So you've like reclaimed that. And it's just so beautiful. And I think therapists should be aware. So I just wanted to say thank you from my heart to yours, because first I miss the subject, I miss you, and I just love this. And 100% for you and for this. So
thank you so much. This is all I wanted. I wanted therapists to be really educated about CMT and mental health, and others with CMT to know that it's okay to go to therapy and to talk about things and talk about the experience on a deeper level than just, oh yeah, I have CMT, it sucks. Like, no, like I was depressed, like that's okay to talk about, right?
Totally. Yeah. It's translated and filtered out through different worldviews, and then sifted out through different lay terms, and then it doesn't really capture our experiences. So wonderful discourse, and I'm just so thrilled.
Thank you.
Cheyenne, I would jump in here and just say that I think it's really an interesting point that you just brought up. Angie, is that your name?
Yes. Yeah.
Oh, okay. Angeline, I like that better. I'll call you A-Bomb, whatever works. I just think it's a really important point that you brought up, is that there's a lot of labels and categories that as human beings we tend to use, that I have come to see in my experience that not only do I not react to people when they try to put me into a category, but I feel like you can't just go around it, you have to go through it. You know what I mean? And so if someone is trying to put a label on you, that's their way of kind of compartmentalizing new information. If you ignore it or put shame upon it by reacting to it, then it can kind of permanently fixate that wrong impression. But now I've come to see that, it is people understanding each other and each other's challenges and differences that help us to then put those categories to rest. And once they're kind of put down, that's when they can stay down. For example, Cheyenne and myself and several of us on this call have CMT, but I would venture to guess that there's not one person on this call that doesn't have something that challenges them
Yeah.
day by day, right? Like one of mine is CMT, one of mine is immaturity, one of mine is being controlling. Like I have got a whole list, and I'm sure we all do. And so like Cheyenne so beautifully and energetically can teach others about CMT. Cheyenne can learn from others through her work and through her life about other challenges she doesn't know about. It's kind of the cool part of it all.
Absolutely. Jonah, I feel like you should just take over. Like, are we at camp again? And like, you'll just we'll like sing a song or something. Like, all right, cool. We're just doing Camp Footprint now. Jonah is the director of camp, one of the directors of Camp Footprint. So that's all. Yeah.
Good to meet y'all. Good to meet you. Love you, Cheyenne.
Love you, Jonah. Thanks for being here. Thank you all for being here. I really appreciate it. If nobody else has any questions, I don't mean to put you on the spot, Jill, but Jill Thomas is one of my good friend's moms, and she's also a healthcare provider. And I don't think you know very much about CMT and what my experience was and mental health, or I mean, you know a lot about mental health, but can you just kind of give your perspective of hearing it for the first time and what that experience was like for you?
Yes, thank you so much for the opportunity, Cheyenne. I wanted to share. I'm very humbled to be here. My name is Jill. I've known Cheyenne for many, many years. She holds a special place in my heart because she's been such a very good friend to my son. And just today, I just saw her post on Facebook the opportunity for this presentation. And so I invited myself, and I'm sorry that I was a little bit late. But I'm a licensed clinical social worker. I have been for almost 30 years. I'm in private practice, and I do work with people who are grieving about many different things in life. And the light bulb just went on, Cheyenne. Like, I just have never had a client come to me with a medical diagnosis, believe it or not, many, many other things, death of a child, you know, sexual abuse, many, many other things that they're grieving, but never a diagnosis. And so this just was so helpful for me, Cheyenne, just to hear your story and your journey and just how important it is to not shy away from walking with people through this diagnosis or any other diagnoses, and that there is a grieving process. And there's also, like you said, a celebration and an ownership and all of that together is so important. So thank you so much. I'm so grateful to be here.
Thank you. Thank you. I really appreciate that. Alrighty, folks. Does anyone else have anything that they'd like to share or question?
Erin wrote something really nice in the chat. I want to read that out.
Erin, I have seen. Oh, hi, Erin. I know Erin. Erin W. What's up, girl? Anyways, so she has CMT, and I identify as having a disability, and I've grown quite proud of that label only because of the disability community that have become family. I'm okay with labels as long as I'm deciding which one defines me. Yeah, it's very, very, very important. Labels can break you or make you. And I think having a support system really helps that out, really helps it be okay. Jill was also mentioning like going through the process. I'm all about positivity and, oh, it'll be okay. But you know what? Sometimes in therapy, you want your therapist to just sit with you and let you cry. Let you cry that having a disability or having mental illness or having something sucks. And that's okay. Sometimes we need to just be present in the moment, processing that. And then we can be positive, wherever your client is going with that. But it's not always this happy-go-lucky time, and that's okay. It's part of the human experience. We all have the same emotions: anger, sadness, happiness. They all come and go, and that's okay. Yeah. This was wonderful. This was my first time doing this, so thank you all for being here. I really appreciate everybody. Again, I'm just kind of speechless at this moment. We have like 4 or 5 minutes left. So if anyone else has questions or just want to hang out or whatever, I'll be here, but at 4 o'clock, it'll be all done. You sound like a pro. Psh, thank you. Meeting at 7 for Jonah. All right. Say hi to your daughter and your family. Thank you all so much. And yeah, thank you. Thank you. Thank you for the claps, Jess. Yeah, she's my cheerleader. Oh, there's Shannon. A little clap for Shannon. Yep. 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 Oh, thanks. Yep. Bye, guys. Thank you. Thank you so much. Thank you, Anthony.
It's pretty good.
Yeah. Thank you. Thank you. Cool. Now I need feedback. Oh, there's my cat. If anyone wants to see Indy, there's Indy. Hello. Goodbye, everyone. Goodbye. Can you stop the recording?
Yeah.
Thanks.
You want me to end the meeting or stop the recording?
Just stop the recording first, because my parents might want to